Hi guys, welcome to our channel where we demystify all matters health. So in today's session we are going to demystify family planning. And so why is planning our families important? It is because it enables us to have a family size that we can comfortably take care of. You do not need to have a very large family that you are not able to take care of their basic needs. But instead, it is very noble and responsible of you to have a family that you are able to take care of without much struggle. People say that a child comes with their plate. Well, they may come with a plate, but it does not have food in it. We have to put food in that plate. And so it is very important for us to be able to plan our families well and have that number of children that you and your partner can take care of. And so before we dig into the various methods of family planning methods that are available, there are two things that I would want to state right here. And the first one is that family planning is not a women's only affair. All right? And so men need to be involved in family planning. A family is not made up of a woman alone. We have a man and a woman who start up the family, and then the children come in. And so when it comes to planning a family, both partners need to be involved. A lot happens when we are planning families, and therefore the two partners need to come together, understand the various methods that are available for them, and choose the one that is best appropriate for them. And so guys, family planning should not be left to women alone. Okay? There are a lot of changes that occur when a woman is on family planning methods, and they need a support system. A woman is not a baby making machine that you simply press when you want a baby and then you put it off when you don't want a baby. A lot takes place, and so the two partners need to be together, and they need to be able to choose what they can use as a couple, to say. And so men watching this, kindly comment below and let us know what you think about family planning. What discourages you from supporting your partners to plan your families? Let us know, and we can be able to support you as well, so that you're able to support the women. The second thing is concerning the various myths that go around concerning various types of family planning methods. And so you will hear people say that this type of method is causing one to bleed, it's causing one to add weight. It's true, most of the family planning methods have various side effects, but it does not occur to every woman. Women have, and for it's normal that we all have different bodies, and our bodies react to things differently. It's just like the same way one person is allergic to proteins and the other person can take proteins comfortably. So it happens the same with family planning methods. One method cannot work for a certain woman but works for the other woman. So when you hear a person saying that it causes you to gain weight, causes you to have high blood pressure, just know that that is their body. That is their body reacting to that particular method of family planning. And so for your body, it will be different. So let us stop categorizing and naming these certain family planning methods as the one that causes this, the other one that causes this other thing, but instead embrace the one that your body can take in. So you need to try it as a person, get to know if it works for you, and if it does not work for you, there will certainly be another method that can work for you. We have various types of family planning methods, and that is what I am going to be discussing here. I will talk about what is available in our Kenyan setup, and it's of course what we have in most other countries. But in the well-developed countries, there could be more advanced methods that we have here. So if you're watching from elsewhere, kindly you can consult your family planning provider and get to know all the other methods that are available for you. So I'll start with the most basic ones, and then we will develop them as we go further. The very first one are the condoms. Condoms are contraceptive devices, and they basically work by preventing the sperms from getting to the ovum, and that is now when fertilization takes place and we have the woman conceiving. Now we have two types of condoms. We have the female and the male condoms. They are effective only if used the right way. The other method is the calendar method. Others call it safe days. Please note that this method is only effective for women who have regular menstruation cycles. And by regular, I mean their menstruation cycle is between 26 to 32 days. Alright? And so you cannot use this method if your cycles are usually less than 26 days or more than 32 days. It will also not be effective if in the course of 1 year you have 2 or more cycles that are 26 days or that are less than 26 days or that are more than 32 days. That will mean that your cycles are not regular. Okay? And before you start using this method, you need to have monitored your menstruation cycle for at least 6 months and make sure that it is a regular cycle. In these 6 months, your menstruation cycle must range between the 26 to the 32 days period. Other than that, then this method will not be suitable for you. And so the first day of the menstruation cycle is the first day of your menstruation bleeding. So when you have your menses, the first day of your menses is counted as the first day of that menstruation cycle. And so it is considered that you are safe from between the first day to the 8th day of that cycle. So you count from day 1 when you started your menses up to day 8, you will be safe. And then from day 8 to day 19, it is said that you are not safe. And so between day 8 and day 19, you cannot have unprotected sex. Alright, you will need a backup method, maybe a condom. We have the diaphragms, or abstain or use a withdrawal method. Basically note that from day 8 to day 19 of your menstruation cycle, you are not safe and you can conceive in between that period. Then from day 19 all the way to the last day of your cycle, that is the day before you start another menstruation, it is considered that you are safe. Okay, and so I hope you're able to understand how we use the calendar method. And now you need to have ways to help you remember or help you to track your menstruation cycle. We have cycle beads. You can be able to source them. You can use a calendar, the normal calendars, and mark the days. And then if you have a smartphone, you can download apps. We have apps that are available on Play Store or Apple Store that can be able to help you keep track of your period. I'll show you an example of the app, the Cycle Bead app, which has been effective and it's easy to use. Now we move on to another method, that is the withdrawal method. It can work for partners who are able to use it, and this happens. This is whereby the man withdraws the penis from the woman when he feels like he's ready to have an ejaculation, and he needs to withdraw and ejaculate far from the woman's genitalia. Okay. Next, we have what we call lactation amenorrhea method. Lactation amenorrhea method is used by women who have just given birth and are breastfeeding exclusively. It is only used for about 6 weeks, and at this time when the woman has just given birth and is breastfeeding exclusively, the hormones are still low and the woman has not started ovulating again. So it is safe for this woman to have unprotected sex up to about 6 weeks. And so from 6 weeks, when after giving birth, the woman will now need to start on other family planning methods. All right. We then have the pills, and there are 2 kinds of pills. There are pills that contain progesterone and estrogen. Those are the combined oral contraceptives. And then we have the pill that consists of the progesterone only. So I'll begin by talking about the combined one. And now, with the combined oral contraceptive, I have said that it consists the progesterone and the estrogen, the two hormones. These pills are taken daily, and it depends with the brand that you are using. We have a brand that has 21 pills and other brands that have 28 pills. I'll give an example of the most common COC that is available in our Kenyan facilities, the Chaguo Langu, and Chaguo Langu has 21 pills. So you take those pills from the first day, that is the first pill, you take all the way to the 21st pill. Now, from the 21st pill, you need to take a rest of 7 days before starting another packet, meaning those 7 days you're not taking any pill. And then after the 7th day, on the 8th day, you start another packet of the pills. All right? Then we have the other brand, for example, the Femi plan. It's a COC, but it has 28 pills. You take from the first pill to the 28th pill, and then you continue to another packet. You do not need to rest. This is because with the Femi plan, it has the 21 active family planning pills, and then it has extra 7 pills that are iron supplements. So those 7 days that you need to rest when you're taking, for example, the Chaguo Langu, with Femi plan, you're taking iron supplements, and so you will continue with the next packet after the 28th pill. All right? It has its own side effects, and it will depend with your body. Some women have been able to use the pills very effectively. There are other women who have not been able to use the pills. Their bodies cannot take them in. And so you need to maybe try them. If it works for you, well and good. If it has side effects that you cannot manage, then you need to discontinue and get another method that is suitable for your body. Some of these side effects include headaches, we have breast tenderness, you may have nausea, you may have changes in your menstrual cycle, either they are shorter, either they are longer, either you have more bleeding or less bleeding. It all depends with your body. But most of these side effects will clear after for maybe the first 3 months of using the pills, and in some women, they may not experience any of these side effects. So I will insist, it depends on your body. All right? And so if you're using these pills and the side effects are unbearable for you, you don't need to go through the torture. You just need to stop using the pills and get another method that you can comfortably use. Okay? Now, the other type of the pills is the progestin only pills. The progestin only pills, as I said, contain progesterone only. And these pills are 28 in their packet. And for these ones, you take a pill every day. They are mostly used by breastfeeding women. And this is because they do not cut off the milk let down. So if you've just given birth and you're going for your 6th week clinic, they'll be the most recommended for you. Unlike the combined ones which contain estrogen, and that may affect the milk letdown. They are safe for both the mother and the baby, since now the woman is breastfeeding. They are also used by women who cannot take in a method that contains estrogen. All right, the side effects are more similar, like they're just alike as the combined contraceptives, and most of them, the side effects will disappear on their own. But again, if you cannot tolerate them, you just need to discontinue and start a method that your body can tolerate. Okay, and for all these pills to be effective, they need to be taken the right way. You need to take a pill every day, and normally you take your pills at the same time every day. So you decide whether to be taking your pills in the morning or in the evening. If it's 7 a.m., 8 p.m., that particular time that you have decided to be taking your pills is the time that you need to take your pills every day. And in the case you have forgotten to take your pill, take it as soon as you remember. But if you go for a period of 3 days, having not taken the pills, yes, you will resume, but know that in the next 7 days, you are not safe, and so you will need a backup method. Okay, I hope that is clear. But if you have any question concerning the pills, you can leave your question in the comment section and I'll be glad to respond to that. You may perhaps want to know how these pills work in preventing pregnancy. The combined oral contraceptive pills work by preventing or delaying ovulation. Ovulation is the process by which an egg is released by the ovary in the woman, and so the pill is going to delay or prevent ovulation from taking place. When this happens, there is no ovum or egg that is available to be fertilized by the sperm, and therefore the woman cannot conceive. The POP acts also by delaying or preventing ovulation, and it also acts by thickening the mucus at the cervix. Now, when this mucus is thickened, it prevents the sperm from going beyond the cervix to cause fertilization. And so I hope that is clear. We then move on to another pill that is known as the emergency contraceptive pill. An example is Postina 2 or the P2. I know that is the most common in our setup. And please note, it is an emergency contraceptive. It is not a routine mode of contraception. It is only used in case you have had unprotected sex and you think you would be in your fertile days and you can get expectant. Otherwise, if you need a routine family planning method, this is not a method to use. Okay, it contains very high levels of progesterone that could be detrimental to your health if taken on almost daily basis. So let it remain as an emergency contraceptive. It may cause effects such as breast tenderness, nausea. It may change your menstruation, bleeding cycles, but that's just a normal side effect and it will resolve. So let it be preserved for emergency contraception only. All right? And it can also be used maybe at that period you missed to take your other routine pills, or you forgot to go and refill your other method that you are using. Maybe you forgot to go and change your implant, you forgot to go have your IUCD removed and its time expired. Just an emergency contraceptive pills. So I'll appeal to ladies, kindly stop abusing Postina 2 and use it only when necessary. We then have an injectable progesterone, and in our setup, the common one is the Depo-Provera. It is an injection that is given to women every 3 months, and some of its side effects includes weight gain, high blood pressure, headaches, nausea. Those are the common side effects, and most of the women are able to tolerate the side effects. Now, if the side effects do not clear within the first 3 months of getting the first injection, then it is not a method that you can use. So I'll keep repeating that it's all dependent on your body. So if your body can take up the Depo, it is what you can use comfortably, then go for it. If you use Depo at a point and you have, for example, maybe excessive bleeding, you have headaches that do not clear, you have blood pressures that are not resolving, then you may need to discontinue the Depo and get another method of family planning. It is also effective, but only if you get all your injections in time. You cannot delay the getting the injection at any one point and think that you are still safe. And that is now when you hear stories of, I usually get my Depo and I got pregnant. Probably you missed getting your your subsequent injections at the right time, and by the time you were getting the injection, you had already conceived. Okay. One of the major complaints with Depo is that it has a slower return to fertility compared to other family planning methods. And so most women, after having used Depo for a period of time, when they now want to conceive again, it may take them time, not to mean that it causes infertility, but it just delays the body going back to the level where it could conceive. And so there's something that can be done about it, and it's not always the case. Some women stop Depo and they can conceive immediately. So it all depends with your body. We will leave it at that for today, guys. But next Saturday, we will continue with the part 2 of family planning. It's quite a broad discussion, and so we will continue from where we have left today. In the meantime, if you have any clarification that you need to be made, any question, any comments, feel free to leave them in the comment section. I hope that the session today has been educative. You can consider sharing it with your friends. And until next time, goodbye.